I am beyond excited. So today we have talking about fall assessment and how important that this subject is. For you guys, you're both physical therapists. How common do you see falls?
Unfortunately, quite a bit. It's a very common injury, especially this day and age. We're seeing, especially the 65-plus demographic, right. We're seeing a lot of that affecting them.
Difficulties with abnormality or gait are one of the most frequent things we see in the clinic right now in the outpatient setting.
Yeah, absolutely. And of course, first introduce yourselves and who you are. And I think this is a great topic. It's a great subject. It's something that we don't always think about unless we might have an elderly loved one or even ourselves. But it can truly happen to anybody.
Sure. Hi, I'm Dr. Jonathan Ebert.
All right.
Yeah, and I'm Dr. Caleb Satterfield. Both of us work for Benchmark Physical Therapy here in the Knoxville area.
All right. So talk about this Upstream technology that you guys have. This is awesome. I think it's great. Anything you can marry with science to give us results to better our lives is phenomenal. Please talk a little bit about this.
Absolutely. So this little platform we have right here is from Sparta Science. This is their force plate that actually uses state-of-the-art technology to actually assess how a person's stability, strength, and balance are all in one, using a more advanced data collection technique. It really gives us a good glimpse as to some of their compensations, some of their deficits, and what we could possibly do to help them get better.
Oh yeah, hands down. So I understand that we're actually going to be working this today. So show me how this works, and I hope I don't fall, but I think I'm in good hands if I do. So okay. I think I'm in good hands.
Well, the best part is all you got to do is step right up into the middle here, and that little white dot is you in the middle. So that's where you're trying to shoot. So you're just going to stand still.
I mean, balance might be my toughest battle yet.
There you go. So now what it's going to have you do is you're going to stay on both legs.
Okay.
And it's going to tell you to go to the right side. So you're just going to stand on your right leg.
Side. Yep. Okay.
And just try to balance as best you can. Good.
Wore the wrong shoes for this today.
And then back to both sides.
All right. This is so incredible because I'm literally watching. I mean, I can see my balance as I'm doing this.
And then we switch to the left side.
All right. This is harder than it looks. Balancing on legs. I was a cheerleader as well.
And go ahead and take a break. You can step on back.
All right.
So what that does, after a few more rounds, what it would do is basically give us a full analysis of how right side compared to left side. Gives a full breakdown as to what you're struggling with. The neat thing is that even with this, the updates they've made to this programming, it's allowed us to actually better insight as to what exercises we can guide patients through to help them with the struggles that they're showing with some of the data that we've collected in these techniques.
That's fantastic. And I understand actually patients can come and get these free screenings, which is huge, having that access to health care. Talk a little bit about that and what that entails as well.
Yeah, sure. Our company is really pushing for the Move to Live campaign, especially through the end of November. We're really trying to make sure we get the awareness out there and make sure that in this time of fall, we make sure the spread awareness of falls and injuries and that gets addressed, and make sure we help people know that there's a way to prevent it and to just feel better about getting around.
Right, and we're all human. And I understand there's also another test that you're going to take.
Yeah, we use, during the screening, we use a number of assessments. The Sparta's part of it, but we use a number of assessments that will give us a good idea of an individual's strength, balance, gait, coordination. One of those tests is called the timed up and go, which we have set up for you to try today as well. So you got to do the Sparta plate. We'll also do another version. We're going to clear some of these obstacles out of your way.
All right, viewer. If I fall, I'm in good hands. Let's say that again.
That's right. We've got you. So we're actually going to have you start from a seated position.
Okay.
And I'll kind of walk through what we're going to do. So the timed up and go, we'll have you stand up, walk around that cone, come back and sit back down as quickly but as safely as you can.
Okay.
Okay, and safety is more important than quick. Are you ready?
I'm ready.
All right, go. And as we're doing this, we're looking at her speed, but we're also looking at the quality of her gait, looking for any abnormalities. We're seeing how she does turning around the cone, and also how she does sitting down and rising from the chair. And you did an excellent job.
Well, thank you. And thank you guys so much for being here with us today. And we really enjoyed it. And make sure you check out how you can get these free screenings in the community as well.